Hi, Eileen Veilleux The Fam here. Welcome to another installment in our mini mental health series. This is the last installment in my Halloween special edition, and in this one, we are going over alien hand syndrome. So, what is alien hand syndrome, you ask? Well, alien hand syndrome is a rare neurological condition that causes one hand to act on its own free will. Sometimes one leg is affected, though that isn't as common. With alien hand syndrome, the hand isn't under the control of the mind. It moves as though it has its own mind. The affected hand feels foreign to its owner during these episodes and seems to move deliberately to carry out tasks that are unintentional. While it can affect children, usually alien hand occurs in adults. It's sometimes referred to as Dr. Strangelove syndrome, Strangelovian hand, or anarchic hand. Alien hand syndrome could be caused by several factors. Some people develop alien hand syndrome after a stroke, trauma, or tumor. It's sometimes associated with cancer, neurodegenerative diseases, and brain aneurysms. Alien hand syndrome is linked to brain surgeries that separate the two hemispheres of the brain. This may involve an incision along the corpus callosum. The corpus callosum divides the brain hemispheres and allows for communication between the two sides. Surgeries to treat epilepsy sometimes affect the brain in this way. Lesions have also been found in the anterior cingulate cortex, posterior parietal cortex, and supplementary motor cortex areas of the brain in those with the condition. Brain scan shows that people with alien hand syndrome have isolated activities in the contralateral primary motor area. This is thought to be due to the lesions or damage in the parietal cortex. This affects intentional planning systems and can cause spontaneous movements. So, what are the symptoms of this alien hand syndrome? Well, the most prominent symptom of alien hand syndrome is the inability to control the hand as it acts independently. The affected hand may move involuntarily and perform goal-directed tasks and actions. The hand is said to move without cognitive control or awareness. It's as though it's being controlled by someone else or has a mind of its own. The hand may touch your face, button a shirt, or pick up an object, sometimes repeatedly or compulsively. The alien hand may also levitate on its own. The hand may also emerge in self-oppositional actions such as closing a drawer that the other hand just opened or unbuttoning a shirt that you just buttoned. The alien hand is uncooperative and may perform incorrect actions or fail to follow commands. People with alien hand syndrome may sense that the hand or limb is foreign or doesn't belong to them. However, they don't deny limb ownership, which can happen in other disorders. So, how is this alien hand syndrome diagnosed? It's awkward, isn't it? Well, a doctor may diagnose alien hand syndrome through observation and evaluation. Diagnosing alien hand syndrome is complicated because it's a neurological disorder that lacks a psychiatric component. This makes it more difficult to diagnose because behavioral issues are more common than alien hand syndrome. Symptoms can sometimes be attributed to psychiatric disorder, which may be frustrating to the person affected. So, what are the treatment options for this, if there is any? Well, there is no cure for alien hand syndrome. Therapies and pharmacological options for alien hand syndrome lack development, but scientists are working on treatments to reduce symptoms. People who have alien hand syndrome after brain illness or a stroke may recover after some time. However, recovery is less successful for people with neurodegenerative diseases. The condition may be treated or managed using muscle control therapies such as botulinum toxin, better known as Botox, and neuromuscular blocking agents. Benzodiazepines have been successful in some cases, but behavioral techniques seem to be more beneficial. Mirror box therapy, cognitive therapy techniques, and learning task behavioral therapies can help manage symptoms. Visual partial coaching techniques may also help. Sometimes the individual will try to restrain some people and may find that it's helpful to hold an object in the alien hand to prevent it from performing tasks. It may help for the individual with alien hand syndrome or other person to give verbal commands to stop the actions. However, this method may not provide long-lasting results. A doctor may recommend physical and occupational therapies. So, let's give you a few fast facts on alien hand based on the information that we know. Here's a few fast facts. It was first recorded in 1909, and alien hand syndrome usually affects the left or non-dominant hand. So what that is saying is if you're a righty, if you do things with your right hand, it will affect your left. And if vice versa, if you do things with your left hand, it will affect your right. One of the characters in Stanley Kubrick's 1964 film, Dr. Strangelove, has alien hand syndrome. Because of this, some people refer to alien hand syndrome as Dr. Strangelove syndrome. Now, only a few cases have reported that the alien hand will try to harm the individual. Some people name their alien hand. So what is the outlook for this awkward, freaky syndrome? While diagnosis may help to reduce and unease you may be experienced, your doctor will help you to manage your symptoms and set an appropriate treatment plan based on your individual needs. So what this is basically saying, this awkward, rare syndrome, is your hand may all of a sudden just out of blue come up and try to grab your face or gouge your eyes. Or it may, you could pick up something and put it down and the alien hand will pick it back up. Or if you button your shirt with your right hand, your alien hand may come back and unbutton it. These are some of the rare but real disorders that are around, and I just thought it was neat to do these that remind us of Halloween. Now, we covered clinical vampirism, we covered many different rare disorders that are real. Every one of these are real, but they are very rare. But the neat thing is how they remind us of Halloween. You think of Dracula, horror stories. Halloween. Alien hand syndrome. You think of Halloween, alien, you know. There was just so many, and I really enjoyed doing this little Halloween special edition for you. I hope you all enjoyed it. But remember my lesson that I teach each and every time I do these. Learn to see with your heart and not your eyes, because what your eyes see doesn't count. It doesn't matter. It's what counts is invisible to the eye, because only the heart can see it. Look at it as, when you look at people, think of looking at wanting a nut. Okay, you see a nut that you want, whether it's a peanut, a cashew, or any other type of nut that's in a shell. Okay, the shell of the nut looks good, but you don't know until you crack that shell open. When you crack the shell open to get the nut, you look and it's rotten. But you can't tell this until you break the shell open. Well, people are the same way. This is just the shell. You don't know what's inside until you look from your heart. That's when you can see the true person. Always look from the heart and not the eyes. And remember, your words are like a two-edged sword. They can either tear somebody down and make them take their life because we don't know what they're going through, or you could be that person saving grace by uplifting, encouraging, and inspiring to where they're willing to give life another shot. I know if it was me, I would rather be the second. I'd rather be the person to help save a life instead of taking a life. We just lost somebody here on YouTube because of bullying. And this is what I'm saying. When she was bullied, people like, well, it's not that. You don't know what the person's going through. You don't know what mental illness they have, if any. You don't know, period, what that person's life is like. So when she got bullied, that was the straw that broke the camel's back. And she took her life. And that is so wrong. But that person that made her take her life by bullying her, if he has any conscience at all, that is going to bother him. Unfortunately, not everybody has a conscience. But I pray that we don't be like that, and we always think before we speak. See with the heart and not the eyes. Don't judge somebody by what you see and make a rude comment, a snide comment, or something that even you think is funny and there's not a problem. Because you don't know where the other person's coming from. And remember, don't let anybody ever tell you you can't do something or that you're not beautiful. Because yes, I'm talking to you out there. Each and every one of you are beautiful. We're all uniquely made. And we're all created equally. And we're all beautiful in our own rights. No matter what anybody says. Don't let them put you down. If they don't like you for you, well, that's their problem, not yours. Remember, I love each and every one of you for you. You're all uniquely made. You're important to me. If you ever need somebody to talk to, you can reach out to me via Messenger, Twitter, Instagram. Comment on one of my videos and say, hey, get back with me. I need to talk to you. I will look at that comment and I will get back to you. Don't ever think you're alone because you're not. I love you. Bye.